afternoon.
Hi.
Good afternoon. My name is Ingrid Yardley,
Hi.
and I'm a family nurse practitioner, and I'll be taking care of you today.
Okay.
And your name is Mrs. Carol Ruiz?
Yes,
And how do you prefer to be addressed?
I go by Carol.
All right, Miss Carol. Well, what brings you into the office today?
I just moved down from San Antonio, and I just wanted to establish with a provider. My insurance kicked in like 3 months ago, and I was looking to see where I wanted to go, and I decided on this clinic.
Okay, great. Well, welcome. I've just reviewed. I see that you filled out your health history while you were in the waiting room. Thank you so much. And I'm going to go through a little bit of it just to ensure that I'm understanding, see if we have any clarification on anything.
Okay.
Right? And so your occupation?
I'm a nurse.
Oh, you are?
Mhm.
Great. And how do you like your profession?
So right now, I haven't found a job yet, but I'm looking at the local hospital. My husband's the one that works, so that's what's where my insurance came through, his work.
Okay. Is that a stressful situation for you? How do you feel about that?
I'm enjoying the break.
Oh, okay, wonderful. Well, I know
Yes.
you'll be getting a job soon. Just a couple of questions for you then. I see here it states that you are current on your immunizations.
Yes.
However, when was the last time that you had your flu shot? Did you have one this season?
I don't think I had it. I know I had it the last year, not 2016, but I think I had it in 2015. So I didn't take it in 2016.
Okay. And have you had any colds or anything?
Just a little cough, but no, nothing. I haven't gotten the flu or cold.
Okay. And just clear, I think we just didn't get to check this off here. Any smoking?
No, I don't smoke.
How about alcohol? How often? Or?
On occasion, but not like when I was younger. So maybe once a month, maybe.
Okay, about once a month. And perhaps what type of alcohol?
Maybe a beer at dinner time, but that's about it.
Okay. And how do you feel about your eating habits, your nutrition?
So I know that I gained a little bit of weight because when we moved down, I didn't know where to go, the gym, and we were trying to settle in, so we were eating out often. So I know I gained a little bit of weight.
Okay. And so where are you at now? What has changed since you first moved here?
So now I joined a gym. We're all settled in our house, so we're cooking more at home like we used to. So that changed. We're not eating out as much.
Okay. And on your medications here, do you take any prescribed medications?
I take loratadine every now and then for my allergies, but aside from that, I don't take any medications.
Okay. And are those seasonal allergies or?
Yes, for seasonal allergies. So I could go, depending on, I guess, the weather, I could go a couple of weeks without it, but then I'll have to get back on it because then I'll have either the watery eyes or I feel my ears itchy. But that's about the only thing that I take, the loratadine.
All right. How about any over-the-counter medications?
No. Sometimes if I have a hard time sleeping, I've taken, I don't know the name of it. I think it's Sleepy Time tea, but not too often. But if I'm having a hard time falling asleep, I'll make myself tea.
Okay, anything else? How about do you take vitamins or any kind of herbs?
I bought vitamins just because I thought I needed them, but I usually end up forget to take them, so I'm really not taking any vitamins.
Do you take Tylenol, anything, occasion if you need anything for pain relief?
I don't even think I have Tylenol at my house. If maybe Motrin or naproxen, but I don't take it on a regular basis.
Okay. All right, so any pertinent family history? Tell me a little bit about your mom.
Strong family history of diabetes and high blood pressure on my mom's side.
Okay. And is your mom still alive?
No, complications of diabetes.
Okay. And your father?
Yes, he's living, and he's got a history of high blood pressure.
Do you have any siblings?
I am the oldest of 5.
And how is their health?
They're doing okay. I don't really. We talk about how our day's going, but not too much as far as our health. So I think they're doing okay.
Okay. And how do you feel overall? How do you feel with your health?
I think that I'm doing okay. The last time that I had my labs, I think it was like 2 years ago. I don't even remember how long it was. It was just a routine exam, and my labs came out okay. My provider said that I didn't have high cholesterol and my levels were good. So I was just following up with her whenever I got sick.
Okay. You mentioned a little bit ago about your mother having diabetes, and so I wanted to ask you: Have you have you had your blood sugar checked, or have you ever been diagnosed with diabetes?
No, all my labs had come out okay. So, but then that was like I said, it was over a year ago. Then I had my last labs. But he knew about the history, so I guess that was one of the labs that he ordered. But he said all my labs were fine.
Okay, great. I'm glad to hear that. Okay, well, let's see. Have you had any recent blood work, X-rays?
I don't think I've ever had any X-rays, and like I said, I think my last lab was maybe 2 years ago, a year and a half. It's longer than a year for sure. The last time I had any lab work.
Okay, and I just wanted also to see on your preventative health. Could you tell me a little bit about the last times that you've had a PAP or your mammogram?
The mammogram, the last I heard with my insurance, I think it was like maybe 3 years ago, because I was going every year because I would follow up with my GYN every year, and then something had to do with my insurance, and then they would only pay for the exam every 2 or 3 years. So I think I'm coming up to 3 years on my mammogram. The PAP, I think it was 2 years ago also, and that was the last time that I had the PAP.
Okay, great. So is there a way that we can double check those dates and get you scheduled if it's time?
So I think what I need to do, because I didn't know where I was going to go, so then I could, whatever the process is, to get my records transferred over. But yes, you can have access to that.
Wonderful. And you know that all the information that we're discussing right now is confidential.
Yes.
And we're just getting to know each other here a little bit, and so I'm asking you some questions so we'll know how to better be able to help you, to assist you. All right, so any other, do you have any diseases, any kind of joint stiffness or? No. Like I said, I didn't want to wait till I got sick to go try to look for a doctor. And like I said, as soon as my husband got the insurance, I was looking around to see what clinic. And I didn't want to wait till I got sick. And I'm just thinking about the strong family history that I have with diabetes and high blood pressure that I just want to make sure that I kept up with my labs or had a provider to go to. Okay. Well, I see today when you came in, your blood pressure was excellent. It was actually 118/70.
Awesome.
So congratulations on that. And so
Thank you.
sounds like that you are due for your annual labs, you stated. So why don't we do that? We'll give you an order, a recommendation for getting your annual laboratory analysis done. And keep an eye on that blood sugar.
Okay.
And we'll give you a follow-up. And we'll discuss all those when you come back.
Okay.
And if you have any concerns or think of anything that you'd like to bring up when you come back, please feel free to do so, and look forward to seeing you again.
Okay. Thank
Okay,
you.
We'll see you in about a month.
All right.
Okay,
Thank
great.
you.
Thanks. Have a
Nice to
great
meet you.
afternoon.